The second big problem found after we had started the primary school, we discovered that a lot of our children were sick and quite a number of them were dying, and they were dying from simple things like diarrhea and for temperatures. So in 2016, one of our sisters came from Kenya. We were able to start a new clinic. And again, it's become a very formal and a popular clinic for the community. This, in South Sudan, the statistics would be that 65,000 people share one doctor, and that's if you're lucky. In our area, there are some healthcare facilities. There is no medicine. There are few trained personnel. So when we started our clinic, it became a big focus for the community. Our babies are the most vulnerable, and this is the project that we are now working with Mary Ward International for, and it's the under fives. They're the most vulnerable in our community. We have a very high infant mortality rate, and we have a very high maternal rate for mothers. They say the statistic in South Sudan is a 16-year-old girl is more likely to die in childbirth than to finish secondary school. And this is a very big project for us as well. Having a primary school has been a perfect way into parents and health and hygiene, because once we have the children in the school, we're also able to educate the parents, monitor the children, ensure that there is feeding and there is good care, and all under the guise of education. So it fits in together in all of it. The other project in the clinic, the nutrition program. Many of you will know South Sudan has a population between 11 and 12 million, of which 7 million are hungry. So our nutrition program is a huge project. We, particularly for our under fives, and again, this is where we partner with you, we would bring our small children to the school, into the clinic, and they would even come their older brothers, their parents. So instead of feeding one child, you end up feeding a whole family. At the moment, we have 100 in that program in the school as well. When we looked into the whole issue, it's as you develop into the whole area of nutrition, we also discovered our twins were particularly vulnerable in the community. Our mothers are breastfeeding, and many of our mothers are not able to produce milk for 2 children. So very often with twins, one of them will die. We now have a thriving twin program. We have 15 sets of twins up to the age of 7 months, where we're able to provide milk for the mother and also support the mother with her own nutrition program as well. And this has been a very popular program in the community as well. I think in many cultures we would feel blessed with twins, but in this culture, twins mean a burden and people struggle to support them. Then from that program, we started the vaccination program. And this is where mothers would come from the village for their vaccines. South Sudan has one of the lowest return in vaccine completion. We had a phone call last week from the County Health Development Office for Health, wondering how is it that in Loreto, we're able to get the parents to finish the program for vaccination? And would we mind adding more communities and villages where the mothers would come? The response from the mothers was that we trust the medicine we get in Loreto. We don't trust the medicine in other places. So today, Loreto, our clinic, is responsible for 7 different PIAMs, which would be small villages around, and it is increasing. So these parents would come once a week for, well, a vaccination program is once a week, but the team in the clinic also go out to those villages 3 times a week to also offer some clinical support to the families as well.